In the incredibly high-stakes world of pharmaceuticals, where one tiny mistake can have huge consequences, how do you make absolutely sure that every single task is done perfectly, every single time? Well, the answer lies in a document, but not just any document. It's one that's designed to be a living, breathing guide. Think about it like this. What if you were trying to get around a new city, but the map in your hands was from 10 years ago? You'd be hitting dead ends, you'd miss all the new roads, you'd be completely lost. It sounds crazy, right? But what if that exact same problem was happening inside an industry that makes life-saving medicine? Well, in the pharmaceutical industry, those maps are real. They just aren't for streets, they're for processes. And they're called Standard Operating Procedures, or as everyone calls them, SOPs. They literally guide every single step of making a medicine. And this right here gets to the heart of it. An SOP isn't some historical document that you write once, file away, and let it gather dust. No way. It's meant to be a dynamic, living guide that shows exactly how the work is supposed to be done, right now. This whole focus on the now is all about guaranteeing two things: safety and consistency. It doesn't matter if you're calibrating a super complex machine or just putting a label on a bottle. The SOP is there to make sure the 10,000th time that task is done, it's just as perfect as the very first. But here's the catch. The world that these maps are trying to describe, it's always changing. The landscape inside a pharmaceutical company is never, ever static. I mean, just think about all the things that can change. People find smarter ways to do things, so processes get refined. New, better equipment gets installed all the time. Government regulations get updated. And sometimes just the way people work together evolves. All of this means your map can get outdated fast. And this is where it gets really dangerous. It's not about people trying to make mistakes. You could have a dedicated employee following the official procedure down to the very last letter. But if that procedure is old, they could be doing something wrong without having a clue. For the regulators who inspect these facilities, this isn't some minor paperwork issue. An outdated SOP is a massive red flag. It tells them there's a serious breakdown in the company's quality system, and believe me, they see it as a major failure. So how do you stop this from happening? Well, you build a really rigorous, formal process for keeping that map, the SOP, perfectly up to date. This is one of the most important jobs of a company's quality management system, which is basically the entire framework they use to keep their products safe and effective. Now, a formal review isn't just a quick skim. It's a deep dive. You're asking, does this piece of paper actually match what people are doing out on the floor? Are we following all the latest government rules? Did we remember to include that change we approved 6 months ago? And maybe the most important question, is this thing actually written in a way people can understand? And this isn't something that happens once in a blue moon. The industry standard is to do this deep dive review on every single SOP every 1 to 2 years. It's a regular checkup to make sure things don't drift too far off course. And get this, the system is so strict that even if you do a full review and find that absolutely nothing needs to be changed, you can't just shrug and move on. You have to officially document that the review happened. It's proof that the system is alive and working. And when a change is needed, it's not a free-for-all. It follows a very controlled path. First, you have to figure out the full impact of the change. Then it has to be formally approved by the right people. After that, and this is so important, everyone who is affected has to be trained on the new way of doing things. Only then, once everyone's up to speed, does the new SOP get put into practice. So let's talk about the stakes. What does it actually look like when this system breaks down? What are the kinds of things that auditors find when they show up to inspect a facility? Honestly, the difference between a good system and a bad one is night and day. In a good system, you'll only find the current approved SOPs at workstations. But what auditors often find are expired, old versions still floating around. In a well-run place, every change is documented. A common audit failure? Finding SOPs with little handwritten notes in the margins, or a revision history that's totally blank. And all of this brings us right back to our main idea: properly managing your SOPs. It isn't just about managing paper. It's about keeping your entire quality system alive, healthy, and actually useful. At the end of the day, a quality management system isn't something you build once and then just admire from afar. It's more like a living thing inside the company. And the constant cycle of reviewing and updating its core documents, the SOPs, is what keeps it breathing and connected to the real world. You can really tell a lot about a company's true commitment to quality just by looking at how they treat their SOPs. Are they just dusty relics sitting on a shelf? Or are they active, constantly updated guides that people actually use? A well-maintained system, it's like a strong, steady pulse. It's a clear sign that the organization is healthy. And that's a question that applies to so much more than just the pharma industry, isn't it? Think about your own workplace or your team's workflow. Is the rulebook you're following a living guide that reflects the world as it is today? Or is it just a historical artifact from a world that doesn't exist anymore?